My name is Karlyn Green, and I recently had a publication in the Cardiopulmonary Physical Therapy Journal. The purpose of the publication was to assess the potential risk of major cardiac events before initiating aerobic exercise. This is increasingly important given direct access to physical therapy. This scoping review aimed to identify and synthesize methods to assess cardiac risk, potentially ones that are used by other healthcare professionals. We also wanted to define the level of cardiac risk, providing statistical data when available. We wanted to know the likelihood of major adverse cardiac events, such as acute coronary syndrome, myocardial infarction, or sudden cardiac death. We used the PRISMA extension for scoping reviews, the PRISMA SCR. Using this reporting guideline, we conducted a scoping review. I like to think of a scoping review as casting a wide net. We want to know what kind of literature is out there for this topic. So we searched 4 online databases, and we used criteria to identify our inclusion criteria for the articles that we actually included. Some of our inclusion criteria were articles that were published in peer-reviewed journals from the inception to the search date, articles that assess cardiac risk or the risk of a cardiac event, and we wanted to specifically look at adults in the outpatient setting with any health condition. We did have some exclusion criteria, studies that were reporting past versions of the tools that had been updated, case studies, expert opinion, clinical commentary, those were also excluded. And then publications that used strategies that physical therapists might not have access to, such as cardiac diagnostic testing, specific laboratory values. We felt that physical therapists may not have access to those, and then they would not be able to use that method as a result. So those articles were also excluded. We did a 2-round screening process performed independently by 2 researchers, and a conflict resolution was completed by a 3rd researcher. Data extraction was completed independently by all 3 parties, and the method of risk assessment that was deemed similar were compared. So what did we find? The search yielded 1,764 records from the 4 databases. 38 of those were ultimately included. 12 of the articles used cardiac risk factor assessment, so looking at the cardiac risk factors as we would normally view them, looking at things like smoking, history of diabetes, hypertension, those kinds of things, counting the number of odds ratios for the major adverse cardiac events. 10 of the articles used exercise testing using an ECG. The remaining articles use different methods, including patient questionnaires, a risk calculator, or some sort of physical examination assessment. Cardiac risk factor assessment yielded the most statistical information regarding the relative risk of cardiac events. For example, hypertension yielded a 1.9 odds ratio for an acute coronary syndrome, smoking at 1.61, high cholesterol at 3.353. Suggesting that people with these diagnoses are at a higher risk of a cardiac event. However, the risk calculators provided a clearer assessment of the risk level, low, medium, or high. They do require some information, such as cholesterol levels, but it was a really clear way to assess cardiac risk, again, in the low, medium, or high categories. So physical therapists actually have a lot of options and different ways to assess cardiac risk. The use of questionnaires such as the ACSM recommended PAR-Q, risk factor assessment, or a risk calculator could be used to identify the level of risk in patients. Patients who are considered intermediate or high risk should participate in an exercise assessment to gauge the appropriate cardiovascular response through vital signs.